Hi, I'm Dr. Seth, and this is how to prepare your peptides for injection. So when you first get your package, you're going to have a vial of peptide. It's going to be a small little vial and a bacteriostatic water. This will also have a little plastic cap on it, but this is not a new vial and I didn't have another one for this demo, so we're going to pretend that there's a cap on here that needs to be removed. So your peptides will probably be in a powder form and will need to be diluted. So first things first, we're going to wash our hands and have a clean surface to work on. Don't necessarily need one of these check pads, but if you have anything, paper towel, you can put that down. But if I was doing this for a patient, I would have gloves on. But if you're doing it for this yourself, just make sure your hands are clean. Okay, now that that's out of the way, your vial of peptides will come in a powder form that needs to be diluted. First things first, we're gonna make sure we have everything. We're gonna have our syringe, our alcohol swab, peptide, and water for dilution. Now we're going to remove the cap from both vials, pretend. And then we're going to open our alcohol and rub the tops. Okay? This insulin syringe comes in many sizes, but what we're going to do is fill this to the 100 mark. You'll want to make sure that your syringes are full 1 cc's or 100 units to start, because they do come in different sizes, and we want to make sure we're getting enough water for dilution to get the correct dosage. You're going to want to remove the cap from the plunger first, and then remove the cap from the needle. Now, you're not going to want to use the same syringe for your injection as you are for dilution, because the needle will get dull. So I like to pull back the plunger first, put some air into the vial that makes it easier to draw out the solution. So I like to hold the syringe against my palm to stabilize it, and then put the vial on the needle rather than trying to do it this way. So syringe against my palm, stabilize it, and then easy insertion. Okay, push the air in and draw back. Fills very easily. I'm going to pull it all the way back to 100. Now, to prevent it from going back into the vial, which it will do slowly, I can see it going, you're going to pull back to where you want it, hold it, and then pull the vial off. Now, once you put it into here, it's going to suck it in, okay? So all you need to do is put your syringe against your palm. Once again, put the vial on the needle rather than the other way around. So insert, and you'll watch it go in. I don't even have to do anything. So then remove needle and throw it away. If your dilution calls for 2 cc's, you're going to fill it twice if you don't have a larger syringe, okay? So we're going to gently invert this. Make sure all the powder is diluted before you do any injection. We don't want to shake it too vigorously, otherwise there'll be too many bubbles and we won't be able to see if it's diluted properly. So once it is a completely clear liquid, no signs of powder, no chunks or anything, nothing floating around in it, you're ready for your injection.